in the warm-up point, and we still continue the same. And of course I tap to the wood and there is an instantaneous I will just go a bit backside. So this is the lifting. See, no murvana has been used, no bandage has been done, and from 90 degree it is nearly 180 degree, nearly. The lifting, it is so instantaneous, and that's why people sometimes feel if there's some sort of magic involved in, which is not the case. It is totally scientific by all means, and this makes us realize that in injuries also it is very effective. And as you can see, the full lifting and the people waiting outside. So if I close this, I would take the next slide and we will see how he was feeling towards the end of all that being done. I have went through the process of the procedure very quickly because it can be easily learned, and of course I will be summarizing how Varmam can be effectively done even by ladies doctors, even by gents doctors, even by young doctors towards the end of this presentation, and why it is so effective. And further on also I'll make few comments on how we will be able to help the fellow doctors achieve their targets by the practice of Varmam. So, and this is another situation where I am doing certain manipulation on him, and it's again Varmam that is used at the posterior axillary fold, and we would make sure that that is very much seen to you in the video, because this gentleman, he did have a problem of the external rotation of the hand. I'm just rushing through it. You will see it more properly in the video in the website itself. But anyway, the main purpose of that to be shown to you was to make sure that you are in a position to realize how quickly the benefits come with Varma. It is so fast acting. So I'm just rushing through this video, but you have seen the major part of it. So this was a case, if the first one was with a respiratory or cardiopulmonary, this was like a locomotor, the second one. And third is a case of a urinary block for 36 hours. So we're getting somewhere to the genital urinary tract. So we have three different headings. Of course there are more, and there are failures also, and there's also a case of the vertigo, which I would just leave for you to look into the website with the video, because there's nothing I can prove in this as I could show in the other two videos, because that was a lady who had vertigo so severe that she was just battling and not even able to walk properly enough when she came to the OPD. And after the Chevi Kutri and the Kutri were done, the spots we call Varmam, she had enormous relief, to the extent that the relief was sustained enough to make her go back home with full confidence of not falling down on the ground. And also I did keep on tracking her, and I even took her the feedback after 12 months, and how she was feeling good is in this video, and after 15 months also I have that feedback. And of course I left the place almost 3 years ago now, almost. But what I meant was that even in vertigo it has such an impact, and of course there are the list of indications are long, but it's very much there in the website for you to realize. So we would conclude the video evidence of Varmam by looking into a case that was 36 hours of block and of the urine, and we did fail. And I'm being a bit open here, and I'm compromising the policy of ARI in terms of the fact that I'm not qualified or authorized to teach anybody, but to propagate is my idea with the Varmam. Is somebody with urine retention, I'm just showing because I had no other option but to shoot it with the measurements. And this was the case in our hospital in the district, and he did not have any urine evacuation for 36 hours even after being done Avagaha, Matra Avasti, Kashaya Avasti, suppository being done, and even a local Piju with Muruvenna and whatnot, whatever was feasible, the normal Ayurvedic measures. And here in this case, again you will see the video how he describes about his condition, and then this is how the abdomen would look like. And then I would put the sound on now further when we start the procedure, and that will be like this. This was just before, and this is during the process. And what I would prefer is to make sure that I put the video with the sound on, so that will make it easier. And then I start the process. But anyway, these are the things that would be easily taught by the ARI if you try to learn it, and this is it is being done. And as you see, within the first 10 seconds, he is telling, it is, as the gentleman tells that he feels, of course I cannot show it by showing his organ concern, but we just have to rely on his testimonial, how he says, I'll just make it a bit more that as we start, again make it, because we need to ensure that it's nearly the first two touches and he feels that the urine is flowing out. So we could think about for a prostate case or any situation where the urine flow is obstructed. Of course, we do not discount the fact of using a urine catheter to evacuate the same. So this is reassuring them, even if some bowel movement happens, nothing to worry on that. So as you can see, now see, I can get a grip here. Isn't focus here? The cursor. I can loose out. The area is showing the kind of looseness. It's quite loose now, this area. This focus here, cursor. Yeah. And of course I'll rush through it. He said, prostate he says 1 to 1.5 thousand is close to no, you can see like 60 to 90 ml, which is fair enough. And I'll just close it here now, or I'll mute it also, because the reason that is why we make this video here for you is that the reason to show it is primarily because in this case nothing responded by the purely Ayurvedic measures. The patient was suffering and the relief he finds is instantaneous. So there are many such indications that are so easily doable. And I would conclude the Varmam section now, and I would not take the time to show the other interesting videos in this. Is that the idea of Varmam to be done is very easy. If somebody has 10 fingers, he can easily make it. You don't have to be a muscle man to do Varmam, at least by the methods of ARI. You need to have the knowledge of those points that is to be done. You need to have the situation of what we would call as the right kind of application of pressure that is easily taught by the ARI, Coimbatore, and you just have to make sure that you're documenting it well and recording the symptoms before and after and during the procedure, the follow-ups. So which would ensure that you can easily implement it in just the following sentences. 1. You don't need more than 5 minutes or maximum 10 minutes to do the therapy for somebody for Varma. You don't need more than your 10 fingers. You just have to learn the points and how they're implemented. You just have to know the indications, and it is so easily doable, and it's not a mystery science. It is a proper documented science with all its share of scientific reasonings and protocols of therapies, and it is so easily doable that it can even be delegated to your junior doctors, or it can be even delegated to people who are unable to make any sort of proper working hours suitable to them. So you can ensure that you're giving it to your therapist also, or your paramedical staff. That is how Varmam becomes so easy to practice, and we take extreme pride and pleasure that few of us, me, Dr. Sajeev, Dr. Rajesh, and Dr. Chandramohan, Dr. Patel, few of us, and most importantly recently Dr. Jayachandran, have done our best possible to spread the message of Varmam and to conduct camps to help people to know that there is something like that exists, and that others can also easily learn and spread the message further. So this is how I would come to a conclusion of the Varmam. So if I make the full summary of the whole situation, I would say that it is very essential for us to ensure that we have a very documented system. I have my email address and the phone number mentioned. I'm not very enthusiastic when it comes to picking up phone calls, but if I receive a text that somebody needs any help, I quickly call back. But I would say that, and you have my phone number and the email address for any kind of clarifications. The idea is that it is very much possible to give quicker relief, to save money, to have lasting effect of therapies, and to make a quick, good socio-medical impression on a patient if we follow these methods of the Anushastras and the Tamil system of the Varmam that is propagated and taught by the ARI team in Coimbatore, that is the Tirumular Varmology Institute. And that makes the life of people easier that we come across, and also it makes our own professional status better, and we feel more credible for ourselves, and also we feel more blessed that we are able to make quicker relief, and we are also able to save the time and the money of the people who come to us, and more importantly we are able to uphold the faith with which they come to us to have cure if possible, if not at least full-time cure or long-lasting cure, at least relief and solace. That is what we are supposed to offer anybody. So I thank you very much for the time you have spent to look into these slides. As you know very well, the indications and the checklist of these procedures would be separately uploaded in the website. You will have it as a PowerPoint, and the videos would be full-blown for you to see, so that you realize that you are in a position to look into the whole feedback of these patients one by one. For the sake of privacy, some of the videos that had the ladies as patients and those who may be a bit uncomfortable with them being published in an open domain like a website, I have either edited or I have removed. But then I can always make those things communicated by audio voices, and maybe you can just trust me on that. But one thing is for sure, we would need a situation to innovate or rather upgrade or to streamline our present method of management, and we will have to come out of long stays in the IPDs. We'll have to come out of only the Kashaya practice, and we'll have to come out of the prescription level practice only and get into more involvement in the process with the patients and make their life better, and in the process of course make our life also much more better. Thank you very much.
Ready.
This is a very simple presentation. As you stayed at the Athra Resort under the care of Dr. Jayalakshmi and Dr. Girish, I thought let me take responsibility of making some awareness of the Ayurvedic therapies, how they act on the body and what you can expect. A few clinical evidences that comes in our normal routine practice in the clinic that will help you to relate how these therapies are acting on the body, and maybe at a certain other level also. And I think it's easy to start with a very common condition that we face these days, which is a disc herniation or a disc prolapse or disc extrusion or bulging, whichever way you call it, like a slip disc. Is such a common entity for a very common clinical feature called the low back ache, and of course the neck ache also pretty common. So we will start with a look into how a normal spine would look like, and this area will be focused now in the camera so that you have a feel. This is how it looks like from the side and how it would look like from the straight anterior to posterior, and this is the lateral. So this is how, in the focus here, this is how it looks like. And just to look into the vertebrae and the disc, the blue one here is the disc, and of course this will slip and get into this area, and this is like a sponge effect. And as you can see more better, this is the best labeling. And here you have, if I halt it, I think it is better that I get the new, like this may be a better look. I'll make it a play, and here I should halt it at this point, because this is the disc that will hit here and pinch the nerve, and then the pain will go down the leg or the hand according to the side. But this is a much more easy way to realize how it looks like a disc, that like a shock absorber effect. This is the blue is a disc, and if you can focus in this area. But this is just to showcase to you how a disc would look like. And when we deal with a situation like low back ache with a herniated disc, and this is the area to be focused, the cursor, and you can see the disc getting spread or the ejected, or I won't say oozing, but the slip, and that causes the pinchial nerve and the pain down the line. And of course there are other conditions that can cause similar, but anyway we are dealing with only the herniated disc as of now. This is also another condition, but anyway we are here to realize that we need to have a realistic feel of this is a different slide. I will just prefer the top one. Yeah, here is the disc herniation of somebody who was 51 somewhere in 2008 at the beginning stages of this resort, and this lady had no other option, either do Ayurveda and give a shot to Ayurveda or go for surgery, which she was not physically fit for. And if you can see in her, there is a big prolapse here, very clear enough, and you can see the blackish disc, we call the degenerative disc disease with intervertebral disc prolapse. And here there are some white spots that would signify the hydration aspect, that is opposite of degeneration of the disc. And if you go like this further, as you can see that this is in 2008, and here is the disc herniation, the focus here. This area is the action, and this is a different one. And here, if this cursor is a white normal, this is the abnormal. This is the L4, L5 level. But just to tell you, she was here for 3 weeks and she did all the panchakarmas that were suitable to her, the enema, the vasti being the most important for her. But of course there are other therapies like Dhanya Mladhara, the enema being done, the what we call as the Kati Vasti, where you make an oil tank, being stagnant at a certain level of the vertebra wherever the action is required, and such therapies. And she had a scenario of going back after 3 weeks of therapies, and after 3 years, of course, we do find the changes happening in the disc correction happening after close to 16 months from the completion of therapies. But having said that, it is not a must. There are many patients who have the same status of the MRI before Ayurvedic treatment and even after. The condition in an MRI reading or the MRI plate would be the same structurally speaking, but the patient is totally happy, totally symptom free and absolutely healthy. So we would never consider health to be verified only by an objective finding. We would prefer the idea of subjective finding.